Hi, everybody. Welcome to Conversations with Calvin, We the Species. This is a huge welcome. Why? Because I'm with Dr. Steve Weintraub and an orthopedist, sports medicine. We're going to talk all about this. Steve and I have been, well, he's been my orthopedist for, I guess, a quarter of a century. And Steve has kept me put together because I needed to be put together. And actually, it's a little promo. But in my second novel, which got a Kirkus store, There's a Tortoise in My Hair, Steve Weintraub is noticeably there as an important character. Of course, I always change the names to protect the innocent. Remember Dragnet?
Yes.
Yeah,
Great show. Great show. Yes.
great show. Great
Great show.
show. And
You're gonna, Calvin, you're gonna age me. You could age yourself, but don't age me. I'm only
okay,
39. I've
that's
been
fine.
I've been 39 for 22 years. So, we're gonna
Hey,
keep it that
I'd kill to be 59.
way.
Hmm.
Okay.
By the way, I'd kill to be 69. I'd
Mm.
kill to be 75.
Okay. All right, Calvin. We got you. You're
We
doing
got
well.
it. So anyway, this interview with Dr. Steve is about pickleball. The
About
good, the
football.
bad, and the injuries from a sports medicine professional. It's hugely important because pickleball is exploding. So, and I'm so grateful that you gave me the time before you got to go run off to football tonight and stuff. That we're going to do this because it's hugely important. And my Johnny Carson monologue has officially ended. Um, so I'm going to turn it over to you,
Um,
to Dr. Steve. A little intro, a little bio, whatever you want to throw in, and then we're going to jump in pickleball.
you got it. I'm ready to talk about the pickleball.
Yep, take it away.
You want me to take it away? So,
Yeah, just do a little, a little background and
well, I think when you look at pickleball, a lot of people don't know what pickleball is, may not have heard of it. In this day and age, a lot more people are hearing about it. But I think when you look at the general scheme of everything, you're looking at racket sports or paddle sports as a whole. And what I've looked at in my practice, and I'm not just a hair club, president. I'm also the hair club member, if you remember that commercial. So,
sure.
besides me treating people with pickleball issues and talking about pickleball with my patients and clients, I'm also a pickleball player. I play at least 3, sometimes 4 times a week. Um, and again, there's a lot of benefits to pickleball and there's a lot of risk. And when we talk about anything in medicine, we talk about risk benefit ratio. So, pickleball being a sport now, again, and talking about racket sports in general, I think there's a lot of benefits we can get from it. And when we talk about benefit to risk ratio, I think I'm going to show you by the end of this podcast that the benefits clearly outweigh the risk of injuries and issues that pertain to pickleball in this case, or to racket sports in general. But pickleball is now being the fad and being this high growth sport in this country and around the world, Canada as well. And I'll tell you, I'll give you one story. I was on a cruise last year with my son, and they converted the basketball sports courts to pickleball.
Wow.
And I was teaching pickleball to people from Sweden, people from France who've never heard. And I tell you, I don't know how it's picking up in Europe, but bottom line is, I mean, they loved it, and we had tournaments, and we played, and there was a lot of benefits from picking up a sport like pickleball, especially for the middle-aged and upper echelon, and I'll call you and me middle-aged.
Oh,
I'll even
thank
call
you.
you middle-aged, Calvin. All right, I'll put
Thank
you
you.
in. Right.
Wow.
So when we talk about pickleball, you want to know, like, what is pickleball? Again, it's a paddle sport. We kind of think, a lot of people think it just kind of came out of nowhere when COVID started a few years back in 2020. But actually, pickleball has been around since 1965. It was invented by this gentleman, Joel Pritchard, Bill Bell, and Barney McCallum, who lived out in Washington State. And one was a politician and whatnot, but they were kind of well-to-do people who was dealing with a staycation with their families and their young kids, and kids were bored. And what they did is drew some lines on their big driveway making a kind of a mini tennis court, put a little net up. He had a wood shop in his basement. This is Pritchard, and he basically cut these little paddles, wooden paddles, and they used a wiffle ball at the time. It was a wiffle. It wasn't they didn't call it pickleball initially, and they played this little tennis game. And the story goes, and whether it's true or not, the story, and I use this story all the time, that they had a dog named Pickles, and anytime the ball would weir off the court, and even sometimes I'll go, the dog would go chasing that ball, grab it, and then retrieve the ball. And they say, "Hey, this is Pickles ball." So it became pickleball. Okay, and that was 1965. So think about it; it's been around for a long time, and it was basically up in that the Pacific Northwest corridor that stayed for a while. 1966, they first started doing some tournaments. This was people getting into it, and they developed a pickleball club and all that. And then it was 1972 where the first pickleball tournament was held now at the South Center Athletic Club in Seattle. So it was growing, but again, mostly in that Pacific Northwest. And then in 1975, lo and behold, all of a sudden, this United States Amateur Pickleball Association, the USAPA, was established. And then, lo and behold, in 1984, the first national tournament was held in Arizona, actually. So now you're starting to move toward the East Coast, right? You're getting a little further to the East Coast. And summarize it, I'm not going to go through year to year, but come to 1997, where the International Federation of Pickleball, IFP, was founded to help promote the sport globally. And again, the growth was mostly in North America. And then go to 2001, now we're moving fast. The first USAPA IFP rule book was published establishing the rules of the game. What are the rules of the game? You hear about this whole kitchen. What's a kitchen? Stay out of the kitchen. Are we not going to cook today? It has nothing to do with that, but the court is kind of, and I wish we could put a picture of the court up on the screen, but the court is kind of a backward tennis court where there's a square, a rectangle close to the net that's called the kitchen that you're really not allowed to volley from. Remember, this is almost half the size of a tennis court. You're using wooden paddles and you're using a ball similar to a wiffle ball. We now call them pickleballs. They have holes in them, and the holes allow air to go through, of course, so the ball can move with some type of velocity because, just easy to kind of keep an eye on and retrieve. So then come to 2015. Pickleball was officially recognized as a provisional Olympic sport. And you asked me prior to us getting started, is this going to be an Olympic sport someday? It might be. The IOC is talking about it and thinking about it, but at the end of the day, who knows? They're going to pick their sports. But we see sports always, kind of popping up in the Olympic scene, and I think pickleball's growth, now it's a professional sport, has been tremendous, and I think eventually it will be an Olympic sport. Come to COVID. Why did COVID explode it? Number one, now you have this sport that the older population can play. Now, the older population is more concerned about getting ill, getting COVID, because those are the ones who are more susceptible to severe illness with COVID. So you could distance yourself still play a sport. The court is half the size or almost half the size of a tennis court. And, when you're getting older and you're developing arthritic changes or some disability or slowing down, certainly running on a tennis court, which is a big court, trying to retrieve balls can become a little difficult for the aging population. But again, you develop this sport now that allows them to exercise, to get some aerobic, exercise in, and still be relatively safer than running these long distances on these big tennis courts. So really, that's how it all began. COVID made it a popular sport, and it's huge now. I mean, I have a place down in Florida, and in my development there, they have dedicated pickleball courts. Initially, in the East and the Northeast, they weren't dedicated. We just took half of a tennis court. We drew some lines. The lines are specific, and we created these pickleball courts. But now clubs are popping up all over the place, as locally in our area. We have a number of clubs that are specific to pickleball, and they have pickleball courts, So where do you want to go from here? Do you want me to discuss what
I'm going to ask you quick questions. It's funny. You've been treating me admirably and perfectly for a quarter century. I function and stuff. And one of the questions I've been starting to nudge you about, do you think I'll be able to play pickleball? And then you were brutally honest and you said no.
Mhm. Well,
So
well,
I
I apologize about that answer.
no, no, it's a true answer. I mean, my knees, my back, there's all kinds of stuff. And listen, I played up until 9 years ago. I played tennis, twice a week for 25 years. And that was and hey, it is what it is. It's
I think I might have to backtrack a little bit on my answer to you. I mean, yes, advancing arthritic disease in the spine and advancing arthritic disease in the hips and knees can certainly mitigate the fact that you probably shouldn't play a sport that requires cutting, twisting, and bending. But again, it's different levels too. I mean, there are different levels of play, and we've kind of the pickleball associations have developed this kind of grading system, 1 through 5, let's say, where, you know, we have leagues for even 80 plus year individuals playing at just a slower level and at a lower level. And that's okay.
right.
There's still, everyone says, well, I'm 80 something years old. Can I exercise? Can I get benefit from exercise? And the bottom line answer is, even for the elderly population, yes, you can get benefit and it can help you with the way you feel, the way you move, and with longevity. Even if you're getting yourself 1, 2, 3 years longevity, as long as that longevity gives you some quality of life too, I'll take it in a heartbeat, and I'm sure you would as well.
Sure.
I think the benefit again of any kind of activity, and again, I'm not saying pickleball is for everybody, and some people might not even like it as a sport, but as I do in a lecture I give called The Aging Athlete, you got to keep moving. You got to keep doing things because once you stop moving, it's hard to get going again. So, I really perpetuate that. I think this invention of pickleball or this growth of pickleball has created this kind of fill the gap, so to speak. I go to these centers and I play, and there's people from the ages 20s all the way to age 80 who are playing at different levels, of course, but especially the middle-aged and older population who might have not been doing anything, now getting out there. Number one, they're socializing. Number two, they're getting aerobic, benefits. And number three, they're getting the mental benefits. Okay, and it's a combination as we age. Getting the aerobic and physical benefits, but also that mental benefit is so important for us. Okay.
Okay.
So when you talk about health benefits, if you allow me to summarize it, number one, the health benefits of pickleball. Number one, it's a low impact workout. What does that mean? You're not doing jumping up and down like off a block. But again, there's not, especially in doubles pickleball, you don't have to move that fast and that much distance. I mean, there's still motion. I'm not saying there's not, but again, there's minimal stress on the joints, making it suitable for these age groups, these middle-aged and older age groups. Number two, improves cardiovascular health. Anytime you get that heart rate a little up, it doesn't have to be 120, 130. You get that heart rate moving a little bit, you're getting that cardiovascular benefit. And we know that exercise is key. I'm sure any cardiologist you talk to will tell you that. Doing something, whether it be riding a stationary bike or if you're bored with that, maybe it's playing bocce, even just moving around. Gardening, we know, does some aerobic effect for you. But again, something like this, which is low impact, now give me some cardiovascular benefit. So be it. I think it's great. And then it enhances agility and reflexes. That eye-hand coordination, using those skills. It's good. It works great. It allows your agility to get better. And again, as we age, we lose balance, we lose proprioception, we lose that ability. But this is giving us some of that proprioception back. It's allowing us to be safer in the real world, even. You play once or twice a week, and now you're walking better. You have better balance. You have better agility. That eye-hand, that eye-foot coordination. And then I think the most important benefit from pickleball is that social interaction and that mental stimulation. I mean, a lot, as we age, one of the biggest problems in the aging population is isolation, and isolation leads to depression. And depression, of course, leads to giving up on life and the bad quality of life. So be it. You're going to these centers. You're meeting your 8 to 10 of your friends or friends you just made, and you're playing the sport. Whether you win or lose, who cares? That's the glory of it too. Unless you're crazy competitive, who cares if you win or lose? You're out there just enjoying yourself with your peers, with your friends, getting that cardiovascular benefit. And all of a sudden, we have a social, I play competitively on the weekends, but Wednesday night I play with my girlfriend. We play in a social group with girls and guys. And at the end of it, we go out for a little dinner or we go out for a little, again. So now, and we've never knew these people before this year. We just randomly got picked to join this social league. And now, who would have thought, that this would be something in our time, in our age group, in your age group, that we can do. Listen, in the days back when I grew up in New York and Brooklyn, playing basketball in the parks and stuff, yeah, that's social too. You meet a lot of people, but then you're young, you're moving around, and you're not thinking about it. Now we're thinking about it, and now all of a sudden you're doing stuff, and it brings me back. A lot of the guys I used to play basketball with who can't play basketball anymore because of the high impact and the high stress. A lot of these guys I'm meeting again and befriending again, and like, hey, we used to play basketball together. Now we're playing pickleball together. So why not? It's excellent.
Wow, great stuff. By the way, you're like an encyclopedia.
Yeah.
Well, you are. I mean, I'm sitting here, and all right, let's just talk about prevention of injuries. What are some of the injuries you've been seeing a lot of in your practice? Uh, Special shoes. What kind of injuries are prevalent, and how do you prevent them? By the way, are there also special shoes for pickleball yet?
Yeah, there are, and I invested in 2 pairs of them. Um, I think there are companies, some better than others. I'm not here to advertise or market for companies. I happen to wear Swiss K's that are pickleball shoes. I think you just need a good supportive shoe that has a very comfort sole, that supports that arch, that supports that heel, that supports the balls of your feet, because there is a lot of stress when you're in short distance, high impact. You're getting a lot of stress. And I'll be a big advocate, again, not marketing for a company, but saying, when I first started, I was wearing regular type of sneakers or regular tennis shoes. My feet would be killing me after
Wow.
2 hours of pickleball.
Wow.
Then I started wearing true pickleball supportive shoes, and it's like a 360 degrees, where now my feet are comfortable. They feel good at the end of a match. It's a perfect no. As we age, our feet certainly collapse somewhat, and they take on a lot of stressors. But I think a proper shoe is very important. Okay. And that brings us to what kind of equipment do you need? But what are listen, I've talked about all the positive aspects of pickleball and that what I talked about, but what are the negative aspects of pickleball? And let me tell you that, there's the injury risk. You're right. You talk about what are the injuries we see. Because of the rapid lateral movements and quick change of direction, it leads to ankle sprains and knee. I see a ton of knee and ankle injuries. Okay. Some people are just overly aggressive and will dive for a ball. And I tell people, don't risk life or limb. But I've seen elbow fractures, wrist fractures, of course. But the most common, yes, what's the most common, I think, is our knee and ankle injuries, still, as with most sports that would require quick stop and quick turning. Okay. So again, proper shoe wear, proper protective wear, whether it be an ankle stabilizing brace or something like that, if you have weak ankles, whether it be a knee sleeve or a light knee brace, that's fine. There's nothing wrong with prophylaxing, and there's no 100% prophylactic brace out there. But before prophylaxing, we talk about, what do you need to do? You need to condition. You need to get yourself in some type of condition. A lot of these injuries early on, the first year that pickleball was very popular, we're talking about 2021, let's say 2022. New York Times came out with the article. There were $500 million in pickleball injuries in that first year.
Wow.
It was tremendous, and one of the issues, I think, and my theory, again, I don't have data on this, is that people would just come and play totally deconditioned. Oh, they were overweight, they were deconditioned, they were not doing anything, they weren't warming up, and they would just go in and play, and these are the people that were breaking down. And I think we've come to realize that even pickleball, you need to be in some type of conditioning program, and warm up prior to you playing, of course, and I think people have become to realize that. Um, and I know for my own self, I ride the bike, stationary bike, 5 days a week. I'm not going to market it. It's a Peloton bike, but I ride that 5 days a week, and I stretch pretty much 5 days a week. And then prior to playing, always stretch and get ready to play. And I do wear some protective gear, which we'll talk about in a little bit. But again, what other risks are there? What are the other negative? There's the overuse injuries, okay, that can result. Tendonitis, which we see a lot of, particularly in the shoulder, elbow, and wrist, because again, it's a racket sport where you're doing a lot of overhead and you're doing a lot of repetitive motion. Anytime you do anything repetitively, you're over stressing that body part. Whether it be the shoulder and the cuff, whether it be the wrist tendons, the extensors and the flexors of the wrist. And then the other issue that we have to address, besides injury and whether it be acute or overuse, is sun exposure. If you're playing like someplace in Florida or outdoors or in California, where you're out in the sun a lot, and certainly at our age, middle age and up, we have to be very weary about that sun exposure. Sun exposure and moderate sun exposure is good for us. As far as we age, what does sun do for us? It stimulates the skin to produce vitamin D. Vitamin D is so important in our bone health, and certainly so that's a benefit. But again, I always tell people, wear some sunscreen when they're going out to play for a couple hours. Make sure you're protecting your skin besides protecting from injury as well. Okay, so very important. All right, so we talk about injuries, and again, what are the other injuries we get concerned about? Would be head and eye injuries. Very important too. Remember,
Sure.
it's a ball, even though it's a light wiffle ball, it's getting hit at times with high velocity, and at times hitting you in the head or face, because again, you can get away from things usually, but again, getting hit in the eye with a wiffle ball or a hard ball or a tennis ball, that could be detrimental. Okay, so in tennis, it's easier to get away from a ball because the distance is tremendous and you have time to react. But in pickleball, one of the risks is it's a small court, but sometimes the ball is hit with very high velocity, especially on an overhead type of smash, which is allowed beyond the kitchen. And if that's coming at you and hits you in the eye, that can cause, corneal abrasions, hyphemas, retinal detachments. And we see that a lot. So one of the things that I specify, especially when I talk about racket sports, to my patients and clients, is wear protective eye gear. Very important. And they make very specific non-fog protective eye gear to protect your eyes. And I see it's one of the biggest things. Most people do not wear eye gear, but I'm seeing a lot more people wearing it. I'm hoping it's not because they had an injury and, but as a prevention, wearing protective eye gear is very important. So again, proper shoe wear, maybe prophylactic bracing, for the knees and for the ankles, and then eye gear to protect from eye injuries is very, very important as well.
God, I never even thought of that, the eye stuff, because, I play tennis, but you're right. I never wore protective gear because it's a big court. By the way, you said something funny, not funny, but
Uh,
no, it wasn't funny, but it rang when I first met you, I was coming out of meniscusectomies.
Meniscectomies, yep.
Yep, I had two, and that's when you and I began our 25-year journey together. But way back, you mentioned the bike and warming up, and you have a Peloton, not mentioning name, but it's funny, 25 years ago, or maybe longer, actually, you guided me that a stationary bike would be good for a lot of reasons. So I listened to you, and I got a Schwinn, uh, a recumbent bike, which, by the way, testimony to Schwinn, I'm still using.
That's great. Schwinn's a great
25,
product.
never had a day problem with it, never. So 25 years, I'm still using that Schwinn bike because of you.
That's great. And again, a recumbent bike, especially with someone who has maybe some spine issues, is excellent. You're getting a good aerobic workout. You're still getting some core strengthening even on a recumbent bike. But these are the benefits that you get. I mean, especially without putting stress arthritic joints or knees or hips. So biking for me and advocating for cycling has been something I've been doing for years and years. People always ask me, what can I do to stay in condition if I can't run, if I can't jump or do plyometrics? Cycling and swimming, of course, but not everybody can swim. But most everybody can cycle. Okay, and especially on a stationary bike or a Peloton type bike where you don't have to maintain balance. You're just maintaining your aerobic, activity, and
Yeah.
it's a core exercise and it's a benefit for aerobic. Okay. So again, a lot of benefits to that as well. But getting back to the benefits of racket sports in general, and I'd like to say I'd like to go to the cognitive benefits of racket sports, if you don't mind.
Yeah,
You
please.
know, we're seeing a tremendous change in people's mentation, like I said, whether it be the fact that they're moving away from being depressed or lonely, and now they're more sharp, or whether, again, using that eye-hand coordination. Number one, racket sports in general, and especially pickleball or even ping pong, improves cognitive function. It enhances your focus and concentration. It increases your reaction time, again, increases your proprioception, your balance, your ability to walk in space. And as we age, the biggest problem we have in the aging population might be falls. I mean, someone who falls, has the risk of fracturing a hip or fracturing a spine. That could be an end of life thing too. So, the fact that we're able to better ourselves with balance and proprioception with utilizing these racket type sports is a big plus. And then again, I'll always go back to the stress relief and mental well-being of racket sports or pickleball in the sense that we're being social and we're just doing something that we're hopefully enjoying. I think most people I see have a smile on their face when they're playing. I mean, there's some overly competitive people, but for the most part, the people I'm watching in these settings are just enjoying life, and enjoying being mobile again, doing something again, with a group. It's great.
I'm sitting here listening to you, and of course, missing tennis, and maybe I setting a goal for myself with your help to get to some level of playing pickleball again.
I listen. I will take you out. I will show you and teach you.
Okay.
I do teach a lot of pickleball, but I want you to understand that when you start playing at a higher competitive level, that's putting a lot of more stress on some of your joints and stuff. And I, again, we look at risk benefits. I still think the benefit for even you getting out there certainly outweighs
Yeah.
the risk of injury. Okay. Um,
So that's now a goal. I need a goal. So I have a goal, Dr. Steve.
Great. Goals are great. And you know that duct tape fixes everything. So we're good. We'll just tape you up. you know.
I have it right here. I have a
Um,
whole roll, different
so
colors.
I just want to tell your audience that that's how I've been keeping you together with duct tape, and it works. It's
And
beautiful.
and it does work. And anything that works, I'm hugely grateful for. So I think we've covered. I'm looking at. I have my notes, and we covered a whole bunch of stuff here. Uh, Kind of wrapping up. I want to. I like to go. I'm a big guy who likes to go off topic. And your favorite sports. So I'm going to ask you some random things.
Well, right now my favorite sport is pickleball, and I still
Okay.
play some golf. But I mean, growing up, I played. I'm a tall guy, not as tall as you, but I'm a tall guy like you. I played basketball in Brooklyn and played high school ball, and certainly played a ton of intramurals in college, and played in men's leagues in Jersey up until I was about 48 or 49 when my knees started feeling it, and I just thought the risk of continuing to play basketball, which is a high impact sport, outweighed the benefit. And there was a lot of benefits in a sport like basketball. Number one, again, social. You're out with a bunch of guys, you're having a good time, aerobic, and again, it's a thinking sport like most sports are. But I transitioned, and I'm happy that pickleball became a thing because I transitioned to tennis, but I blew out my calf playing tennis, and partially tore my Achilles. So certainly tennis is a great sport, but as you're aging, things do break down too. So, it's a high level sport where you're actually pushing off and have to move really quick, really fast, and significant distance. And there are people I have a lot of patients and clients that are playing tennis way into the 70s and 80s as well, and still play tennis. So I'm not poo-pooing that sport. I think it's a great sport. It's still the king of racket sports.
Yeah.
If you look at the other benefit, which most people want to hear, is longevity. I mean, and they've done recent studies, and racket sports in general have the best results as far as longevity or increase in longevity. 9+ years added to your life for people who play
Wow.
racket sports on a constant level. And
Wow.
that's better than soccer, that's better than even cycling, that's better than running. So it's a combination of the aerobic, the cardiovascular benefits, and again the mental benefits. We talk about 50% of medicine is up here, is above we call it supratentorial in the brain. And if your brain is positive, if you have positive attitude, glasses half full, you're going to get better, and you're going to, your brain supports every other aspect of what you do. And if your glass is half full and you're not enjoying and you're negative, it's going to affect your physical well-being, of course. And you know, I just want to give, before you close up, I want to give one last uh benefit that's really important. And again, it's back to the mental health, and it's being studied now, is dementia and racket sports. Dementia is a big part of my family, a big part of my family history, as you well know, and it's very close to my heart. But dementia, racket sports may help reduce the risk of dementia even, or even slow down dementia, again, because of this mental and this eye-hand stuff, and using that brain more and more, setting off those synapses, getting them moving. Coordination and movement patterns challenges the brain. You need to keep that brain challenged. It's one of the things to try, you know, dementia, yeah, it's a genetic disease perhaps, and it's going to happen perhaps whatever you do. But we know these new studies, the preliminary data is coming out showing that it could slow things down or even prevent it from progressing. So better than a lot of these new drugs that are trying to come out to help, and they don't work or they don't last. The older drugs don't last more than a year or two. Something like this, something like racket sports, whether it be ping pong or pickleball or paddle tennis now is becoming big. These sports help slow down the progression of mental loss, of memory loss. And again,
Wow.
that social interaction is so important as far as the
Yeah.
loneliness and depression. So
So,
dementia is being something studied very, very hardly now with use of racket sports like pickleball.
I'm listening to you, and I realize, up until 9 years ago, I had played tennis tremendously. I mean, I played a lot of tennis for 25 years, and now at 79, um, I'm functioning better, I believe. My writing, my podcasting, my broadcasting, my mentoring 17-year-old Rutgers high jump students. So, in other words, I'm functioning better now. And part of the ingredient is something I read called crystallized intelligence. You have a healthy brain, and then if you're able to retrieve what you learned for 79 years, all the better. That's crystallized intelligence. So I'm listening to you and I'm saying, well, must have been a huge benefit for me having played tennis
I
25
think
years.
I think you're a poster child for that. I think all those years of playing racket sport, the eye-hand coordination, the aerobic, the agility, all the things that you did over those years certainly brought you to where you are today.
Yeah.
Uh,
Oh, and then
um,
by the way, I played racquetball. By the way, I balanced. I was a tennis player and a racquetball.
yeah, it's nice to play different types of racket sports
Yeah.
too. I
Yeah.
think that's great. So I think kudos to you. I mean, you
Hey,
know,
I, listen, you've been guiding me along and keeping me so that I can do all this stuff. So, um, hey, another off-topic question, and
go ahead.
some of your favorite movies. I always like to ask this.
Well, one movie that I always quote is a movie called Parenthood with Steve Martin.
Sure.
'Cause, certainly that kind of guides my life a little bit. I know movies probably shouldn't guide your life, but some of them do, some of the movie. But if you look at that movie, it's all about life, and I quote that movie a lot. For instance, the grandmother saying how life is like a roller coaster. and I've been through my downs, but it's how you get through those downs and go back up. Life is going to go up and it's going to go down. It's but you'll get those ups again. But it's about your attitude and about how you approach those downs. So that's one of my favorite movies. The other Christmas movie I love is the one with the I can't remember the name, with the angel.
Oh, It's a Wonderful Life.
Jimmy Stewart, Wonderful Life, one of
It's a
my
Wonderful
favorite.
Life.
I love that movie. Cry at that movie all the time. The bell rings and that's right. That's
Yeah,
right. Zuzu's Petals. I
yeah.
mean, classic movies I love. And the girl I'm dating right now, she's never seen some of them, and I like rewatching them with her because it's fun for me, and it's fun
Yeah.
to see her reaction on how she, and she's enjoyed all these older movies that I love. So those are two of my favorite.
Okay.
Get into the action stuff. I love Alien. I love all those scary type movies. But those two, I mean, and it's certainly Parenthood. If you haven't seen that and you want to just guide your life a little bit, it shows you. It has some good messages. Besides that roller coaster message, it has a lot of good messages in that movie.
Okay. Last
Uh,
question. Back a little bit on sports topic. I always marvel being a student of the Olympics, and every year they break another record. Is there a limit to how fast somebody can run the 100-yard dash? Are we going to actually? By the
yes,
way, are we going to actually? By the way, I just read yesterday. I just read yesterday that we pretty much, and this scared the hell out of me. We pretty much have maxed out on human aging and longevity. Where that's another, according to AI and whatever, we're pretty much there. We'll get a few more people living to be 100. But
don't,
so, but
don't listen to AI. It's like the term. They want to wipe us out. The AI. Don't. But if you look at the population that's being born today, 50% of the population will be centurions. 50% they're predicting will be living to
wow,
100. So if
wow,
you look at the population in 1900, what do you think the mean age was in 1900, turn of the century?
30, 30,
No, it was 50. Okay, or
50.
45 to 50. So you and I were gone long, long ago. And the reason being, again, we didn't have antibiotics. We didn't have modern medicines, cardiovascular medicines that we have now, blood pressure medicine. So people were dying, certainly. And, people with diabetes we didn't have insulin back then either. So you get diabetes and you were done, So, we've come a long way in just a little over 100 years, right? So, I don't know if I could predict that. I'm not God or anything like that. I don't know if I could say this is the max out. But maybe they said that 100 years ago. Oh, we're going to live to 50 for the rest. But the bottom line is, look, we double the age, the amount that we live. So I think we've come a real long way. Now back to the question of the 100-yard dash.
Yes,
Well,
yes.
what do you think? In 100 years, how much from the Olympics, the gold medalist in the Olympics 100 years ago in 1920 to now? What do you think the difference is in the 100-yard dash as far as the how far have we come? Have we increased or bettered our 100-yard time?
I don't know. I'm trying to remember what Jesse Owens did. Um,
Well, bottom line, it's 0.8 of a second.
is that
So
it? Are you kidding?
we really haven't gone that much faster. Yeah,
Wow.
we would think we did, but the bottom line is the human body can only move so fast. So, even yeah, we've gotten faster, but it's not much faster. It's less than a second
Hey,
off
and I got another question.
of the Olympic gold medal time. Yeah.
Yeah, yeah, that's so interesting. So I have another question, and it's just popped into my head because I got a picture of Babe Ruth over there. I have a lot of baseball pictures. So you take Babe Ruth, who ate and drank and smoked cigars, and yet did what he did. So I'm asking you, if he would have lived in this day and age, he'd never be able to play because he wouldn't be able to play. But with the kind of conditioning that you've been talking about now, with the kind of you know where I'm going with this, with the kind of conditioning and the nutrition and all this stuff, what could this guy have done today?
I think the sky's the limit. You're right. I mean, if the babe would have been conditioned and not done all the bad habits that he had, who knows? The sky's the limit for him. You still compare records that are being set now to Babe Ruth stuff. I mean, he's still on the, top five. He's still there. You can't. No one can really match what he's done. Or they try to. It's always compared to Babe Ruth, to Mantle, to all those greats. And most of the records that broke, you look back and sadly you have to say they were enhanced by enhancing medication, drugs and things like that. Where the one thing I'd say, these guys they had bad habits and they didn't have performance enhancing drugs, and they still did what they did. So you're right. I mean, certainly the sky's the limit. Who knows how much better they would have been if they. Number one, I don't say they should have been should take or ever take enhancing, performance enhancing drugs, but yeah, if they took better care of their bodies, So I'm not a predictor, but I'm just saying I think
Yeah.
you're.
I read a book about Sandy Koufax. You're a
Oh,
Brooklyn guy.
I know who
And
he is.
and I read the book, and physically, the physics of Sandy Koufax, the physics of this man was he was the most perfectly built pitcher that ever lived. And it's too bad they didn't have some of the great drugs and stuff that they have now. He could have pitched another 4 or 5 or 6, 7, 8 years.
Well, the reason he left. I mean, he wasn't that unhealthy when he left. He just knew, with some of the minor injuries that he had or some of the injury, he knew that if he kept going, he would have definitely not been able to do some of the. He wanted to. His Really, if I listened to his interview, he wanted to play ball with his grandchildren. He wanted to, he
Well,
said, I just want to have a healthy body. And they asked him, what about the money? But and his answer was, yeah, what about the money? Is it worth not having a quality of life later on in life? And his quality of life has been great,
yeah, yeah,
and he quit when he quit on his terms, and he didn't really care about the riches and the fame. Then they didn't make as much money then as they do now. But and most of these guys just care about the riches, So,
correct. Well,
well,
we're
yes,
done.
we're
This,
done.
yeah, we're done. Wow, this is good. God, yeah, I mean, by the way, I see you, almost every month,
I love seeing
literally.
my
So
my my office loves seeing you.
yeah, I love hanging out there, and I do. It's like my. By the way, it's probably my second home. I don't know if I. It really is a second home. I spend more time in your office after this house there.
Mhm.
So I'm real comfortable there, and I always look forward to my series of injections, and my ortho. It's just great. You're great. This has been great. Uh,
Yes, it's
we
been great
really have
talking to
real.
you. I
Yep.
always enjoy talking to you either on this forum or even privately.
Yeah.
It's always fun. I love going to Rutgers games with
Yes.
you. I'm looking forward to some
Yep.
basketball this
A
season.
lot of basketball
Have a
coming
great
up.
time
So,
meet you and our buddies over there, Vijay,
yep.
and everybody.
But
Um,
our little group.
yeah, a little group. We have a
Yep.
great time at the
Yep.
games.
We
It's just a
do.
lot of fun.
We do.
I look forward to many more years of cherishing, of doing it.
Absolutely. So I'm going to stop recording. Don't leave. I'm going to do a 30-second wrap with you and then send you off to football. This has been great. Thank you so much, Dr. Steve.
My pleasure. Anytime you want me back, I'm
Truly, this is great. Truly great.